Hi, welcome to Health Talk with Dr. Akram. I am Akram. In this special YouTube edition, we're going to talk about hernia. So sit back, relax, and enjoy the time with me. Hernia happens when an internal organ pushes through a weak spot in your muscle or tissue. There are several types of hernia that you can experience, such as inguinal hernia, femoral hernias, umbilical hernias, and hiatal hernias. Most hernias occur within the abdominal cavity between the chest and your hip. The most common forms of hernia are inguinal hernia. In men, the inguinal canal is a passageway for the spermatic cord and blood vessels leading to the testicle. But in women, the inguinal canal contains the round ligament that gives support for the uterus or the womb. In inguinal hernia, fatty tissue or part of the intestine pokes into the groin at the top of the inner thigh. This is the most common type of hernia and affects men more often than women. Let's look at femoral hernia. Fatty tissue or part of the intestine protrudes into the groin at the top of the inner thigh. Femoral hernias are much less common than inguinal hernias and mainly affect older women. Umbilical hernia, fatty tissue or part of the intestine pushes through the abdomen near the belly button. And hiatus hernia, part of the stomach pushes up into the chest cavity through an opening in the diaphragm. Other types of hernias include incisional hernia. Tissues protrude through the site of an abdominal scar from a remote abdominal or pelvic operation. Epigastric hernia, fatty tissue protrudes through the abdominal area between the navel and the lower part of the sternum or the breastbone. Spigelian hernia, the intestine pushes through the abdomen at the side of the abdominal muscle below the navel. And the diaphragmatic hernia, organs in the abdomen move into the chest through an opening in the diaphragm. How common are hernias? Of all hernias that occur, 75 to 80% are inguinal or femoral. 2% are incisional hernias or ventral hernias. 3 to 10% are umbilical, affecting 10 to 20% of newborns. Most close by themselves by 5 years of age, so you don't have to worry about it. What are the symptoms of a hernia? Lump or bulge that can be pushed back in or that can disappear when lying down. Laughing, crying, coughing, straining during a bowel movement or physical activity may make the lump reappear after it has been pushed in. Swelling or bulge in the groin or scrotum, increased pain at the site of the bulge. Pain while lifting, increase in the bulge size over time. A dull aching sensation, a sense of feeling full or sign of bowel obstruction. In the case of hiatus hernia, there are no bulges in the outside of the body. Instead, symptoms may include heartburn, indigestion, difficulty swallowing, frequent regurgitation, bringing food back up, and chest pain. Risk factors for the development of hernia include smoking, chronic obstructive pulmonary disease, or that we call it COPD, obesity, pregnancy, peritoneal dialysis, collagen vascular disease, and a previous open appendicectomy. Among others, predisposition to hernia is genetic and occur more often in certain families. When to seek medical advice. This is really important. See your GP if you think you have a hernia. They may refer you to a hospital for surgical treatment if necessary. You should go to your nearest A&E straight away if you have hernia and you develop any of the following symptoms. This is really important. Sudden severe pain, being sick, difficulty pooing or passing wind, the hernia becomes firm and tender or cannot be pushed back in. These symptoms could mean that either the blood supply to a section of an organ or tissue trapped in the hernia has become cut off, or called strangulation. A piece of bowel has entered the hernia and become blocked, called obstruction. A strangulated hernia and obstructed bowel are medical emergencies and need to be treated as soon as possible. Surgery. Surgery is recommended for some types of hernias to prevent complications like obstruction of the bowel or strangulation of the tissue. Although umbilical hernias and hiatus hernias may be watched or are treated with medication. Our next video is all about it's never too late. As it says, can you tone your muscle at any age? Can you be fit at any age? This is all to do with exercise. When can you exercise, and how can you develop your muscle at what age? Can you do it at 90 years? Can you do it at 106 years of age? It's all there. So be there for us, and we'll be talking about it's never too late. Until then, look after yourself. Thank you very much.